Welcome to China Considered, a podcast that brings fresh insight and informed discussion to one of the most consequential issues of our time, how China's changing and changing the world. I'm Liz Economy, Hargrove Senior Fellow and co-director of the program on the U.S., China, and the World at the Hoover Institution at Stanford University. Today, we're going to talk about China and public health. It may seem like a niche issue, but from everything that the world has seen with regards to SARS and then with COVID, we know that what China does at home has enormous implications for the rest of the world. And to guide us on our discussion, we're very fortunate to have Yanzhong Huang. He is a senior fellow at the Council on Foreign Relations and a professor at Seton Hall University. He's also the author, most recently, of Toxic Politics, an in-depth exploration into how China's environmental problems contribute to its health problems. Welcome, Yanzhong. It's great to have you with us.
Well, thank you, Liz, for having me.
So let's start with what's going on inside China. You have, I think, followed China's public health system for probably longer than almost anybody else in the field. What kind of changes have you seen over time since you first began studying, China's public health system? What has really struck you most about the changes, and what hasn't changed?
Well, I think if you just look at the public health system in China, right, that you've seen, right, they are making significant strides, right, with average life expectancy rising to 78.5 years. That was up from 77 in 2020. They've made so much progress in biotech, that is now becoming a global leader, quickly catching up with the United States. If you look at the data, 2025, 37% of molecules licensed by major pharma firms originated from China, right? Also, major changes in I would say challenges, that are happening in the population. Population aging certainly is acute. Now, 20% of the population, we're talking about nearly 300 million, aged over 60. They have non-communicable diseases, we call it NCDs, and it cause more than 80% of the death in China.
What are those like? That's like what, cancer, obesity, diabetes? These are NCDs?
Yeah, we call the cancer, diabetes, cardiovascular diseases, but all those issues, like respiratory conditions, and their risk factors, if you consider like obesity, right? Approximately 50% of Chinese adults are overweight or obese, according to a 2020 report. Right? Smoking continued to be a challenge, right? Over 50% of the adult men in China smoke. And there's, infectious diseases continue to be a challenge, right? That is exemplified by this year, in the summer, right? The chikungunya outbreak in Guangdong, right? That started in Foshan, driven by mosquito-borne transmission, raising concerns for open spread. There are all these challenges and problems. But in the meantime, if you look at their public health infrastructure, right, continue to be centrally coordinated by the National Health Commission, that oversees a vast network of over 1 million healthcare facilities, including state-owned tertiary hospitals, community health centers, specialized in the Centers for Disease Control and Prevention. They call it also CDC, right? But they have CDCs at national, provincial, and local levels, right? Universal basic medical insurance now covers over 95% of the population. But the benefits varies, depends on what schemes you are subscribed with. The local government now are facing in the post-COVID era all these fiscal challenges in providing, right, the public services, right, they're trying to fix the loopholes, left by in the post-COVID era, right, the public health system, with this this newly revised infectious disease law, now encouraged, which I found this is very interesting. Now, finally, by this law effective, this last month, encouraged individual sharing and reporting disease-related information by, mentioning that entities and individuals who report in good faith are eligible for rewards and exempt from liability if the event is later ruled out. So,
So
yeah, we're seeing both challenges, changes, and also stability in the system, essentially.
I mean, it used to be the case that doctors were not paid well. So the medical profession, it was hard to attract people sometimes. Has that changed? Has government investment in the practice of medicine, for example, improved so that now you're getting more and better doctors, and they're getting paid more?
Well, in the United States, but typically you have the some of the best, brightest people, right, want to go into a medical school. That is not the case in China. Although we're seeing over the past years, this seems to be improving. You have more people get interested in studying at the medical schools and top universities. But I think for those doctors who work at you know, the grassroots level, even township health centers, it's still right. There are few people who trained, receive formal training, right, to work at that level. Even though you were assigned to those institutions, still right that you would try your best to get into like a county hospital, urban hospital, because the pay is not good. Is you have to rely on basic salary, which is really small and not attractive at all. But in those institutions, if you rely on bonus, but you have to count on demand. But the demand for their services is really still small. People would still prefer to bypass institutions for urban health centers.
Oh, interesting. And that, of course, also prompted another challenge in sort of the public health system, which was corruption, right? Because you
Mhm.
had a system where the doctors weren't making any money, and so people would pay them extra to get seen, or they would overcharge for medicines. How, effectively has, Xi Jinping's ongoing campaign against corruption now, I think it must be in its 13th year, how effective has that been in the medical field?
Well, actually, they launched a anti-corruption campaign in the medical sector in 2023, right
Oh,
after
late. Oh, late. Okay, I didn't
yeah, the end of the COVID pandemic. So this campaign so far has punished, I believe, over 40,000 people, including like hospital managers, the health officials, right, who are involved in procurement and bribes. Although that enforcement gaps remain, and that campaign continued. The government has not indicated when this is going to end. I assume that if that all those systematic, problems, sustained, well, there's no way to get rid of all those corruptions in this sector.
Right. I mean, I think we've seen that in many other sectors like the military, where it seems to be a never-ending campaign
Exactly.
against corruption. So perhaps the same will unfortunately be true in the medical sector. So let's talk a little bit about COVID and what you've seen post-COVID in terms of the government's response. I have to say I was speaking at a media roundtable the other day to a bunch of journalists, and one of them asked me whether I thought that China had been sufficiently punished or had sufficiently taken responsibility for COVID. I wonder how you would answer that question. I mean, do you think that China has been held sufficiently accountable for its role in COVID and its spread?
Well, this is the well, interesting question, right? I think in a way, like February, like early February, after Li Wenliang died. By the way, well, Li Wenliang was the whistleblower, right? Right? Who shared the information about
Gotcha.
the upcoming, pandemic. He was then punished, right? And then he died from the COVID himself, right? So at that time, well, you have seen, right? This is sort of like a China's right, Chernobyl moment. People really, like demanding accountability. They flooded the internet, right? Showing their displeasure and frustration. But I think, and many people, I thought that would lead to transformative political change, right? Instead was followed by the information, crackdown, by more tightened political control, and so this the one of the lessons we learned that all this major crises not always followed by liberalization, transformative political change in China. It might be the opposite is true. But I think it's really I found it really fascinating when I was studying right that there's the state response, to the pandemic. It's just that kind of resilience I found very, you could say, impressive. If you consider right this swing between different political modes, right? I think this is the most striking thing, right? Its capacity for sudden dramatic pivots without apparent legitimacy cost, right? If you think about the shifts we witnessed, right? From initial inaction by December 2019 and early January 2020 to the decisive lockdown of Wuhan in late January 2020, then the swing to overreaction with draconian zero COVID for 3 years, but then almost overnight, by in early December 2022, there was a complete reversal, right? Sudden reopening with minimal preparation. And then COVID just disappeared from public discourse entirely, like nothing had ever happened, right? So nobody mentioned it anymore. So I find this is that kind of adaptability, or maybe resilience is the better word. It tells us something profound about how the system operates and maintains control.
So I think that's really interesting. Let me ask two follow-up questions on that. So first, what's your explanation for that? I think it was a December decision to just lift the controls, and overnight, as you said, without thought to some kind of ensuring that people would be protected, or even the elderly somehow. What do you think was behind the decision at that very moment? And then do you think that COVID is still an issue in people's heads? I mean, despite the fact that it's not talked about, is it still in the minds of, people in Chinese society? I mean, presumably many people lost loved ones, to COVID, as they did here in the United States, of course. Is it something that's not talked about, but nonetheless still has lessons, that people have taken away? And what would those lessons be?
Well, first of all, when we talk about forces or factors that led to by the reopening, right? Certainly you could have the confluence of factors, but the influences, right? I think we still need right the more information, right? Of what exactly happened, right? In Zhongnanhai, that made, the government leader to make that decision to completely, right, ditch the zero COVID. And we could just, list some of the, the factors we know, right, that for example, by that time, by November, December 2022, it was clear by that approach is no longer sustainable, right? Diminishing returns problems very clear, right? And there was also, by according to the media reports by those reporters who's based in Beijing, they also, talk about found the information suggesting the government was seriously considering, right, having a new strategy, right, to replace by the zero COVID. That still did not explain why, but the change came so sudden, right, with so minimal preparation, and it seems to be irrational, right? So, I think certainly why in that sense, the November, 2022, all this protest right in Beijing, Shanghai, and elsewhere played a sort of like, sort of a transformative role here, that when the leaders, actually might solve, from the the footage rest of this protest that the people were so frustrated, right, that even right this sort of like the largest protest, since 1989 in a way, right, and then also, right, there's clear, right, regime legitimacy implications there from the slogans they were chanting. I think, they were really shocked, in my understanding, and then I think. Maybe what this again we don't know the exact details. There's some talk about this like a sort of revenge reopening. That is that well this is what you want, right? You want
Oh,
reopening, you want ditch the zero COVID, you got it, right?
wow. Wow.
So
Okay.
it's that kind of but we still again we don't have enough information to make sort of uh, affirmative conclusion, on the forces that led to the change.
Yeah. And what about whether COVID still sits in the back of people's minds? I mean, you continue to go back and forth to China, you do your
Mm.
research, you have friends and family there. I mean, is this something that people still talk about? Is it raised? Do people say, should we be concerned about another pandemic of some sort? How does it play out, do you think, broadly within society?
Well, again, officially, right, from both state media, social media, right, that you seldom heard, right, this term COVID, right? They have those, other terms, replacing that. We call it like during the special times, during the mask era, right? So clearly, but this is still like a politically sensitive issue, a taboo area, that discourage public discussion, right? The the pandemic, the government response to it, but again, the problem is that you have that many people, right, who died during the COVID, especially during that maybe 35 days after the December 7th, right, 2022. We have met people who lost their loved ones, right, during that period of time. They were certainly not happy with that. I can tell, right, that kind of emotion, right, that was suppressed, right, there. The one person just said, I feel I need to do something, but in the meantime, I also feel like I'm numb. This kind of numb. That in Chinese on 麻木了, right? It's so you don't get a clear sense what exactly people are thinking about. It's a kind of very a feeling that was difficult to describe. Maybe it will disappear over time, but who knows if that become part of the collective memory of the society, when the social political conditions change, they might like become
Part of the
forces.
process of
Right,
that.
it's
Mhm.
just like the great leap forward, right? That
Mhm.
they became important impetus, for the rural reform.
Yeah. So that's really interesting. So you mentioned one change in Chinese policy in terms of reporting when you're sick or reporting on a potential disease that people will be rewarded in some way and not punished if it turns out not to be true. Are there other important changes that you think have come about as a result of like lessons learned from COVID by the Chinese government, issues around greater transparency, public transparency, or different ways that health, is being monitored in society? I assume those bracelets are no longer part of, everyday life in China. Is that right? The ones that were tracking people's, exposure to COVID, ostensibly.
Well, COVID is still there, right? And it's still spreading in the country, right? And across the globe, right? It's just that, now it's no longer considered a public health threat, a major public health threat, right? If you consider all this, the government actions on chikungunya outbreak in Guangdong, right? Sort of that was reminiscent of the zero COVID approaches, right, to a localized outbreak, which is certainly much less fatal, than COVID-19 in 2020. So we have seen by this revised infectious disease law, that seems to well, after finally, right, there I thought that there was basically little public discussion, right, right, what we did right, what we did wrong, during COVID-19, how are we going to fix, right, this loopholes, right, exposed during the system, right, there seems to be, right, you don't see that kind of, right, the um, scale of this public health investments we saw after SARS, right, in 2003, right. After SARS, there was you don't there was not just a, like transparency, the sort of you know, this investment in public health. In fact, if you visit any of the provincial by the CDC, by those state-of-art buildings, labs, they were almost all built, in the wake of SARS, outbreak. But you don't see that kind of similar level of investment, right, in the post-COVID era. That is my impression, and certainly, but that has something to do with the local financial capacity, because, right, we know the local government, right, the debt reading, in the era of economic slowdown, right, that they really, right, didn't have that much interest, right, incentive, right, to invest in public health, but at the central level, we have seen, right, some of the like the anti-graft campaigns, the launch of the Healthy China, 2030, more state intervention, like managing people's weight, but that doesn't seem to have anything with like future pandemic preparedness, and response.
So what do you when you say that the government is managing people's weight, they're not going in there like the family planning offices, are they? And actually weighing people and checking on them?
No, no, it's not like that. Well, that's the, but it sort of still reminds me this sort of like Foucaulting, right? This biopower, right? You have this sort of more, it's like a from a laissez-faire approach, right? In dealing with sort of individual lifestyle diseases, like. Overweight, right? The not diseases, risk factors, right? Or diseases like obesity. The you see the government is taking action, right, in those areas, that clearly show, that the government, wants to do more, right, in this field, but it also, right, represents sort of like a subtle, right, the state penetration, right, to people's lives, but in order to achieve, right, this macro health objectives, right?
I see. So more information campaigns and sort of
Yeah, health, wellness,
right.
education, the campaigns, maybe also provide some incentives for people to sort of exercise constraint, right, in their diet habits. That we're seeing that there's people are now getting in China more concerned by their weight. This is how this like this. The weight reduction, right? The camps become so, and drugs become so popular now in China.
Interesting, interesting. Okay. But not in terms of the government actually taking individuals and subjecting them to sort of pressure, right? It's not at that
No,
level. It's a
not that
broader
kind of
campaign.
like
Okay. Okay.
the
It hasn't
zero
gone that far.
COVID type of
Right. Okay.
campaigns.
It hasn't gone that far. That's a relief, I have to say. So let me ask you. I want to talk more about China's role on the global stage, but let me just take a beat and ask you how you decided to study this field of public health. I mean, I think you are, certainly one of few in the United States and in the world. You are one of the top, experts in this space. I mean, how did you decide that this was something you wanted to pursue?
Well, thank you, Liz. So, well, take this as a compliment. Well, why I got hooked on global health and China, uh, let me well, certainly because I'm a Chinese, right? Naturally, when you came to this country, you want to study your country. There's certain, right, comparative advantages like language or cultural, right? But let me take you through this journey, right? I started as a China specialist, right, diving deep into its policies and institutions, during my graduate study at the U of Chicago. So my dissertation focused on Chinese health politics in the post-Mao era, right? Essentially, we look at how the state tackled health issues after those massive, liberal reforms kicked off, right? So that was my first love, really, understanding how China's political institutions, shaped its health policies, right, in the post-Mao era. But when I graduated in 2000, global health was just starting to bubble up as a field, right? It was not a huge field. It was like almost like everybody knows everybody community. But it was this passionate community, like talking about health as a global issue, not just a local one, and also they talk about it as a national, international security challenge, not just a pure public health concern. So I was intrigued, right? It felt like the perfect bridge, right, between my China expertise and the bigger, right, the world problems, right? Then we have SARS, right, hit in 2003, and that was a wake-up call and highlight the health as a high politics issue, right? So the outbreak showed how faster health crisis could spill across borders, and it sort of cemented my interest in global health governance and global health security. And that is when Seton Hall, right, the University School of Diplomacy came calling, right? That they hired me as a global health person, right, to build their global health program. That was actually one of the first to tie health to security and foreign policy in the Professional School of International Affairs. And that to me, it was a dream gig, right, to shape something new. And later, right, I was fortunate to become affiliated with the Council on Foreign Relations, as a senior fellow for global health. That gave me a bigger platform to blend my China knowledge with global health challenges. And also, I was really, lucky, but I was able to work with great minds, great colleagues like you, right, on the China side, and Laurie Garrett and later Tom Boyke, on the global health side. From there, by this is being a wide ride, writing books, right, on Chinese health politics, testifying to Congress, and diving into everything from China's environmental health crisis to its COVID response. So it's all about connecting the dots, between Chinese politics, Chinese policies, and the world's the global health issues.
Yeah, I mean, I think, it's also just you become such an incredible blend of both, scholarship, right? As you said, the research that you do on the issues, which is, rigorous research, but at the same time, there's an ability for you to contribute to the debates and sort of policies that affect, millions, tens of millions of people globally by sharing your knowledge and your ideas. So it's both, it's like a half academic and not activist exactly, but an element, right, of activism, of being able to take your knowledge and really make it worth something. I think on the larger global stage, I think it's terrific. Okay, so a great career trajectory that's led you to, I think, an important place. So let's revert now. Let me just touch on a couple of final issues. China, despite the role that it played in COVID, as the originator, despite the fact that it was not as transparent as should have been, despite the fact that it used its control over personal protective equipment in sometimes coercive ways to try to get countries, not to say anything bad about it or, use it for other reasons, has become an important player in the global public health diplomacy space. I think through its Health Silk Road, for example. Talk a little bit about, and I will say, one of the things I've found interesting just in some of my own reading is that it does seem as though many countries, emerging and middle income economies, don't look at China as bearing the same kind of responsibility that many European and advanced economies do. They have a different perception of the role that China played in COVID, often because China was providing these countries with vaccines when they couldn't get them, for example, from the United States, and notwithstanding the fact that those vaccines were not as good as the US's or other countries, nonetheless, they were very appreciative of the fact that China was selling them. So talk a little bit about how the role that China's playing on the global stage in terms of health and health diplomacy, what its ambitions are, do you think? And then I want to finish and talk a little bit about the US-China sort of cooperation or competition, or how you see that emerging. But first, let's talk about how you see China playing on the global stage.
Well, if you look at it's the response toward the global, right, the COVID-19 pandemic, right? People often, mention, right, this the vaccine diplomacy, right? When I was visiting Southeast Asian countries, the meeting with the the scholars, the government officials there, but they all mentioned, right, that in the uh, at the time, when but the Western countries, including the United States, were practicing their vaccine nationalism, right, stockpiling the vaccines for their own population. Right, it was China, right, who that provided the badly needed the vaccines, right. Even though, by you might say, in terms of the efficacy, by maybe safety, not as good, by as like the mRNA vaccines, although that's debatable to some people. Still, right, China was the first, right, to provide those desperate needed the medical supplies, right, not just the vaccines, but talking about the masks, ventilators, So this is, sort of broadly defined the vaccine diplomacy. You might also call it, the health diplomacy, right? President Xi, pledged that Chinese vaccine would be a global public good. That positioned China as a leader, right, in the global response, and the countries did appreciate, what China was doing, right? Survey data showed that those initial gains, right, that was 56% of the Soviet countries, the journalists, right, observed more positive media coverage of China following the outbreak. And in Southeast Asia, China was perceived as the most generous provider of the COVID assistance, but those gains, proved fragile and fleeting, right? Especially with the rapid spread of this highly transmissible, Delta and Omicron variants, we saw actually a steep drop in the global delivery of the Chinese vaccines, they are since for 2021, right? Then the zero COVID policy initially was marketed as a proof of the effectiveness of the China's solution, right, to the global pandemic. Essentially, become albatross, when China was locking down Shanghai in spring 2022 while the world moved on. Right, this only projected the brittleness, not strength. And then, so by 2022 to 2023, much of that goodwill had evaporated, right? The pure global attitude survey clearly showed, right, that even after all these efforts, right, only 28% of the respondents across 24 countries say they had a favorable view of China in spring 23, right, compared to 59% for the United States. But if you look at the post-COVID era, right, China's health diplomacy, they have pivoted from emergency response to institutionalized health engagement, and they are playing the long game strategically. They've pledged 500 million to the WHO, the World Health Organization, after President Trump announced the withdrawal from the International Health Organization. They have increased health-related development assistance to low and middle-income countries. And of course, the Belt and Road Health Silk Road was a key framework, right, which allowed China continue to invest in hospitals, pharmaceutical production facilities, public health capacity building across Africa, Southeast Asia, Latin America. Well, these are tangible, visible projects, right, that create soft power, right, dependency in a way simultaneously. I think President Trump's second term is absolutely critical, right, to this strategy's effectiveness, right, because it essentially, right, allow China to sort of portray itself as a defender of multilateralism, global health governance. China becomes the go-to partner for countries dependent on foreign aid programs. And that essentially, right, changes the competitive dynamic fundamentally, right? So, China doesn't have to significantly or dramatically increase its health-related development assistance to fill the void, left by the United States, right? They just needs to be present, and why America is absent, right? That's a much lower bar, right, in this competition for global health leadership. And so, I think the you could say why the current administration isn't just an opportunity for China. Its policy not just a present opportunity for China, it becomes a force multiply, right?
Mhm.
Because Beijing doesn't have to be particularly good at, right? Health diplomacy or significantly or dramatically increases health-related development assistance. They just have to be there, when we are not. I think that should worry the United States because leadership in global health governance isn't just about altruism, it's about influence, standard setting, right? Agenda setting and shaping, right, the rules of games for the next health crisis. So if we see that space, we're going to find it very difficult to reclaim. Right?
Yeah. No, you're making a point. I completely agree. And I think about this more broadly in terms of the development assistance and the shuttering of USAID that, people say, oh, well, China's going to fill the vacuum. I said, it's not going to fill the vacuum. It's going to do just enough,
Exactly.
to, because we're gone. So it doesn't need, exactly as you said, it doesn't need to do much. It can go and support the rural reading program in Cambodia for $1 million, and it's going to receive all sorts of accolades just for that.
Exactly.
So I think we're very much on the same page there. And I think the other aspect, and I'm curious whether you think this is accurate, is that it also gives China, all of this health diplomacy gives China the opportunity to promote its traditional Chinese medicine, Chinese-made medical devices. It becomes an economic play as well, an export mechanism, right? As you're
Mhm.
saying, a force multiplier, but it also multiplies other kinds of opportunities for China when we pull out. I
Mhm.
think it really enables them to gain ground in other areas where the United States, may have also had advantages because of our aid, linking to, U.S. made medical devices or Western made medical devices. I think it's another,
Mhm.
entry point for China. Do you agree with that
Oh
or
yeah, absolutely right. That is still because if you look at by this the COVID diplomacy, when they are actually exporting right their vaccines, masks, ventilators, right? It's officially claimed it's as a global public good, but it is not, right? If we, with the we believe that global public good means it's not excludable, by if it's like jointness of supply, right? That the anything but global public good, right? Is actually look the vaccines China shipped overseas, right? 85% of them are actually for commercial sale.
right?
So it's but by doing so, they're not just expanding its geopolitical influence and not just projecting soft power, but also expand its right the commercial right the influence right
Right. Commercial influence and opportunities for Chinese companies. Right.
right.
So one last question. I think, the health space, like the environment, which, I've worked on for many years, is always sort of promoted as an area for good US-China cooperation, right? Everybody says, well, we can cooperate in health and the environment. So, in the current context, what do you see there? Do you see any possibility for cooperation, in particular, given what's going on in the health space here in the United States? I would imagine that opportunities are much, much diminished, but maybe things are going on that I don't know about.
Well, I think this is a great question, right? Many people when we talk about U.S.-China cooperation, they this is just naive, right? this
The
given the
throwaway, a
current, right?
throwaway sort of health environment, right?
Yeah, given the geopolitical tensions, given the lack of trust, and well, this one of the specific right the hurdles is with that COVID-19 origins, right? This controversy, right? Basically, many lawmakers here, right, they said, well, that if you want the corporate us to cooperate with China health, first let's fix this problem first. If we can't even fix this, then forget about any cooperation, right? So that is becoming like one of the biggest hurdles, for U.S.-China health cooperation. But I
So
still.
Yanjun, just so I'm clear, the hurdle is the fact that China won't acknowledge the actual origin of the virus, or what's the hurdle exactly?
Well, the hurdle is basically this is all what the WHO has been demanding. I mean, well, this also has soured the WHO's relationship with China under Dr. Tedros. Since July 2021, WHO has been requesting China to be cooperative, right, in the second stage of the investigation on the COVID-19, the origins of COVID-19. But the first, right, the stage was sort of like a WHO China joint study conducted in the spring of 2021. That they launched a sort of a report in end of March. Basically accepted all the explanations provided by the Chinese side. So that sort of actually damaged the reputation and credibility in a way of the WHO and the U.S. right and then under the Trump 1.0, right? They essentially also, I believe that's basically a whitewashed report, right? They want to China to be more forthcoming, to be more transparent, right? To be more cooperative, right? In the origin survey, but China sort of the narrative here is that right, the pandemic or the outbreak started in Wuhan doesn't necessarily mean China is the origin point, was the origin point of the pandemic. And second, right, that if you believe that the lab leak was the problem that caused the pandemic, let's also investigate for Dietrich, your military labs here in the U.S. So indicating that U.S. could be a origin point of the pandemic. Right? So you have that kind of finger pointing right over the origin of the pandemic. That is becoming one of the biggest hurdles, for U.S.-China health cooperation.
Yeah. So no real prospect, I think, in the immediate future for some breakthrough on health cooperation. Is that fair to say?
Right. Well, if actually, it's, in a way, it's even worse, right? So beginning 2020, right? Since the early spring that year, right, and until 2023 last year, 24 last year, there was no high level uh, dialogue, on public health issues. There was no, of course, there was no serious discussion on cooperation, right, during the pandemic. But even after the pandemic was over, right, that we have, that except for last year, right, that there was a Chinese vice health minister visiting Washington, meeting his counterpart at the HHS. We have essentially no high-level health dialogue. And even the at the working level, now with under the new administration, our diplomats, our health attaché, well, actually, there's no formal health attaché there now is acting. There was sort of they're very cautious in terms of reaching out their counterparts in China. That is very unusual. I would say abnormal, right? And this shouldn't be the case. As when I was in Beijing, a Chinese diplomacy professor, at the leading top university in China, said, if there is no cooperation over health, how could you expect the effective cooperation in other areas? It just shows the dire state of U.S.-China relations, unfortunately.
Yeah, no, I tend to agree with you. And I will say, I think even it was up until, like health diplomacy, was up until the, second to last year of the Biden administration before we had real talks on commercial negotiations, on military negotiations. The only thing that was going on was really the climate change discussions. And that was very much a sort of a personal, kind of love affair for, former Secretary Kerry, who was so committed to climate change and had a personal relationship with Xi Jinping. So, yeah.
And unfortunately, but even that, right, this working group now, I think it's that the cooperation has also stalled, right, under the new
Yeah, well,
administration.
I'm sure since we've pulled out of the Paris Climate Accord that there's not going to be much cooperation at the national level on climate change. Okay, last quick three questions, just boom, boom, boom. So first question, what book would you recommend to our viewers, book or article on China that you think is really just excellent and people should read?
Well, I would recommend, a book by Wang Dang, the titled "The Breakneck." That's to have this interesting comparison, between the governance in the U.S. and China, right? Well, China, according to the authors, sort of managed by the engineers, the U.S. Governed by lawyers, and they believe that sort of shaped the different governance model that explain why right now China is quickly catching up in this key, right, the high tech areas like AI, biotech, right, robotics, you name it. Of course, for the author, I want to claim it's not the Tiananmen leader.
No. And his name is, it's his English name, just to be clear, is Dan Wang. So you call it, so it's a little different, but right. So Dan Wang, yes, I agree. It's a great book. And I think it made its New York Times bestseller. And I reviewed it for Foreign Affairs, I think, in the upcoming issue. And it's really, I agree with you. It's a terrific, terrific read. Okay. What issue in China, let's put aside public health though, what issue about China or in China do you think Americans don't really understand or need to know more about? What do you know that other people don't know that they should?
Well, I think what set aside public health, I think it was I'm still sort of puzzled, by these, sort of almost like over the past just a couple of years, you've seen, right, that China quickly catching up, right, in the high tech area, right. Well, biotech is a very good example, right? Just years ago, when we talk about China's innovation capability, which says, well, they're making good progress, but it's going to be a long way before they can catch up. But now, guess what? Right? They're not just catching up. In some areas, they're becoming a leader, right? And in a way, this is creating sort of the another kind of dependence. In addition to the APIs, active pharmaceutical ingredients, key starting materials, but those innovative drugs and the biosimilars molecules, they are, we are becoming increasingly dependent upon them. If you look at, right, the number of deals by the licensing, right, we signed with the Chinese companies. I found it very interesting, especially if you think about this era of economic slowdown, right? Where unemployment rate of the youth is so high, right? That the consumption level is low. The real estate industry is like all prices almost all like is such a bad shape. How could that happen?
Yeah, no, I think that's great. And actually, I'll do a little plug for our next podcast, which is going to be with Dr. Chen Li, who is a well-known geneticist and works on biotech issues and on cancer drugs, and goes between China and the United States. And he's going to talk to us exactly about innovation and science and technology, particularly in the biotech field. So thank you for that lead in, Yanzhong. But one last question for you. If you had a recommendation for the Trump administration right now, either thinking in terms of U.S.-China competition or cooperation, what would it be?
Well, I would say principled engagement. It's interesting when you ask this question. Just finished the tribute to our old colleague Jerry Cohen, right? He was the person, right? That I think if there's something I remember the most, it was his integrity, right? He's the commitment to rule of law and human rights. So he's the principled person, but he had this flexibility, right? That in dealing with people with opposed views, right? So that is how he was admired, respected in both sides of the Taiwan Strait, So, I think, he, as I said in the tribute, that this principled engagement just to show, that when we're dealing with, well, sort of give an example, right? The suggesting that when you're dealing with like a geopolitical rival like China, even we disagreed upon many things, I think engagement and even cooperation remains possible and vital.
And that is a great note to end on. And thank you for the reminder of our truly wonderful colleague, Jerry Cohen, who passed away just recently, a towering figure in the field of China legal studies, someone who spanned both, the corporate work, government work, and of course was renowned for his work on Chinese human rights issues as well. So Yanzhong, thank you so much for a really rich discussion. I expect no less from you, from one of the best and top figures in the field. So I appreciate your taking the time to speak with us.
Thank you, Liz.
If you enjoyed today's podcast and would like to hear more informed discussion about China, please subscribe to the Hoover YouTube channel or your favorite podcast platform.